This is Dr. A.J. Lal from the American Hip Institute in Chicago, Illinois, discussing our preferred technique for the circumferential femoroplasty addressing a large cam lesion in an all-arthroscopic technique. Seen here is the AP done lateral and false profile views of a young 20-year-old male with severe hip impingement-like symptoms during any attempted hip flexion with internal or external rotation. After failing conservative management with minimum of 3 months physical therapy, injections, activity modification, the patient was indicated for an arthroscopic hip surgery to treat intra-articular, both central and peripheral compartment injuries. The patient was placed supine on the operating room table with the fluoroscopic imaging displayed here. The patient's projected portals were identified in the mid-anterior, anterolateral, posterolateral, distal anterolateral accessory, as well as the accessory anterior areas as shown. During diagnostic arthroscopy, a large degenerative full-thickness acetabular labral tear can be seen with adjacent condylabral damage as seen. A circumferential labral reconstruction was chosen to perform reconstitution of the labral seal as seen here. Our attention was then turned to the peripheral compartment to address the large circumferential cam lesion with an arthroscopic burr. The hip was progressively moved from the flexion and neutral rotation to internal and external rotation positions. Most notably, to achieve adequate decompression of the inferior medial and posterior medial regions, the hip was flexed and externally rotated to allow for the burr to move in this direction. As shown in zona orbicularis, the capsular vessels can be seen in this region. Great care is taken to avoid iatrogenic injury to this area. Again, with the hip flexed and externally rotated, the arthroscopic visualization can be seen with the burr mobilized in the inferior medial direction, addressing this portion of the cam lesion to provide decompression. Seen is the pre and post hip check navigated software showing decompression from 87 to 40 degrees and two-dimensional imaging showing adequate decompression in a circumferential fashion. A hip map analysis was also performed pre- and post-operatively showing adequate decompression in a circumferential fashion. Thank you.